الله تعالى وبركاته. الكلام طبعا كان كثير وشمل كل المناحي اللي قامت بها المجلس القومي السوداني من بريطانيا وايرلندا. الحاجات اللي قاموا بها انا ما داير اكررها واعيدها بالنسبه لكم، لكن دائما نظرتنا للمستقبل واسعه، ونظرتنا لازم تشمل التغيير ولازم تشمل التحديث في هذه القوافل. يعني مثلا القوافل ان شاء الله هذه المره شملت الممرضات وشملت الفنيين، وان شاء الله تشمل مناحي اخرى لم يشملها العمل الطبي في السودان. الحاجات اللي بنتوق لها انه الحملات الطبيه الموجهه عن طريق المجلس القومي السوداني ببريطانيا وايرلندا تكون مجهزه باجهزه متكامله. يعني انا افتح المجال لكم كلكم هنا، نحن بنحتاج لعيادات متحركه، مثلا يكون معانا عياده متحركه للعيون ممكن تستخدموها هنا لما نحن ما نكون موجودين، لكن اذا جت اي فرقه من اي مكان ممكن تستعملها، ودي بتؤدي الى فوائد مكتمله بالنسبه للمواطنين في المناطق التي نزورها. ممكن يكون معانا معمل صغير نقدر نعمل فيه بعض الاجراءات، ممكن يكون معانا موبايل ايكو، ممكن يكون معانا ECG ماشينز، حاجات تساعدنا في الديagnostic process and managing these patients. ما داير اطيل عليكم، يعني الكلام كان كله رجاله، ما في نسوان يتكلموا، والناس اللي يتكلموا كلهم سودانيين، واعتقد ندي فرصه لاخواننا البريطانيين في كلمه بسيطه. Those who contributed into this convoy, not only Sudanese, there are some British colleagues who contributed and worked and introduced new methods and workshop into this. It is Charlotte, Christina, and Debbie, and probably Charlotte can give us a few words just about your impression in Sudan and how did you find that, hope you enjoyed the journey.
Good evening, and apologies for not yet learning Arabic. My name is Charlotte Routh. I'm a senior registrar in acute medicine, presently working in Newcastle. I spent my last year in the UK working with Dr. Mahir Hamid, who kindly invited us to join him in Sudan. I have a special interest in teaching and also in remote healthcare, and therefore this was a great opportunity for me to come. We've had a great time here, and we've been really struck by everyone's hospitality, and we're very, very grateful for you to have us and to look after us so well. Everyone's been asking us how we found Sudan. Has it been how we expected? It's been much better than we expected. We have had no problems, and we've been very well looked after. We're very grateful to be able to offer you our teaching, and to offer it especially to the nurses and the doctors here. Our first few days were spent teaching in Khartoum. I spent some time teaching the registrars with Dr. Hamid for MRCP PACES. This is something which I do regularly back in the UK, and I often find that the foreign doctors struggle with our exams because there's very different cultural differences between medicine here and medicines in the UK, but yet they still have to take our exams. So I'm very grateful that we could pass on their knowledge and my knowledge of the exams. I've spent some time organising MRCP back in the UK, so I have a good knowledge of what they need to do to pass the exams. We weren't expecting so many registrars. We had 100 for the practical day, and then 190, I think, for the communication skills day. And this went down very well. Unfortunately, I had to resit my exam 3 times to demonstrate to them how to do it. Hopefully I passed. And Claire and Debbie did an excellent job of being our actresses, taking the role of patients and relatives to show them what they're expected to do in the exam. We also then spent some time working in the academic charity hospital, teaching the nurses there some advanced life support. We couldn't unfortunately run the whole course due to lack of equipment, but they were very grateful for what we did do and to give them some hands-on practical experience about resuscitation. We very much enjoyed our time in Khartoum, but we're very grateful to have the experience to go to Damazin, to see a different part of Sudan and to teach some different people down there. The welcome we had in Damazin was, will stay with us forever. Parties and receptions every night, and the people were very lovely. The countryside was great, and we were very fortunate to be treated to a picnic on the Blue Nile and a cruise on the lake, which was a really great day off. In Damazin, we mainly taught the student nurses. Again, we weren't sure how many to expect. We started with maybe an estimate of 30 and ended up with a lecture theatre packed to the brim with 170 very keen nurses. For me, I taught with two of our very experienced nurses, and we found that just passing our skills to these nurses, things that for us we take for granted, management of wounds, aseptic technique, pressure sores, are things which our nurses in the UK do every day and don't even think about. But for the nurses here, it's foreign, they don't do it. And we weren't teaching them anything technical, we were teaching them basic clinical skills and just how to improve their practice as nurses. And we hope the student nurses that we taught will take this forward into their future careers and take the advice and help we've given them. For us, we hope that some of the thing that we could really put across to the nurses is that they should be taught and they need to be taught, and that's really important. Our nurses back in the UK receive a lot of teaching and they have very good relationships with the doctors, and we really hope that by teaching the nurses we've shown them that they have the right to be taught and acquire knowledge just as much as doctors do in their medical training. One of the nicest things about our trip to Damascene was the students put on a party for us at the end of the lecture, and I've never finished a day of lecturing dancing in the lecture theatre before, but this was really great and we're very grateful for their response. We're very grateful for being looked after so well. The whole time we've had people looking after us, making sure we're well fed. We're sure we're all going home a few kilos heavier, but we've had great food and great hospitality. So thank you, Sheikh Al-Tayyib, for inviting us and giving us this opportunity, and we really hope we can come back in the future to teach and spread our knowledge further. I've been told, so that's thanks to Dr. Noor, who kindly arranged for us to spend some time having our hands painted, which was really lovely, and the lady was fantastic, an amazing artist, and everyone's commented on it, so I'm not sure how well it's going to go back down in hospital in the UK, but who cares?